KIDS and CDRF had jointly organized the third NUCD by reveling in the success of the last two conferences held in 2014 and 15 consecutively. Being the premier hospital and managing diabetes and its complications, KIDS Diabetes and Multi-Speciality Hospital had started the noble initiative of training the doctors of Odisha in the proper management of diabetes.
We are hosting the third national update on clinical diabetes by Kanungo Institute of Diabetes Specialties and Cuttack Diabetes Research Foundation at Bhubaneshwar. This is a 2 days long program in which best of brains in faculties in diabetes have joined, and most important clinical topics are being discussed here. Because as you understand, diabetes is not a blood sugar disease alone. It is a disease of complications. It is a vasculopathy affecting all the organs of our body. So patient suffers from multiple disorders within short time after getting diabetes. If his treating physician doesn't understand these things and doesn't get the adequate knowledge to really educate people, if the people do not get this knowledge, the update, and they do not get the facilities of updated knowledge of their physician, then the patients suffer. That is why, in order to educate the physicians and general practitioners, those who are actually handling diabetes, this program, this ambitious program has been launched into. This is the third year, and we have discussing around more than 40 topics on diabetes, starting from brain to the leg, to the skin, to the sex, to the eye problem. Everything is being discussed. Whatever a clinician faces in his day-to-day life, those topics and those problems are being raised and answered by specialists, those who are masters in their subject.
Basic aim jota jemti amar Odisha ro bibhinna doctor manku educate karibe.
In Odisha, there are 40 lakh diabetics, and 40 lakh diabetics require around 2 crore consultation per year. Every patient requires 5 visits for consultation, and we do not have adequate manpower. There are hardly 20 diabetologists and 200-300 physicians. They cannot provide this much of consultation to our patients. So, all the doctors, those who are looking at diabetes, must be educated, must be trained, must be oriented and aware about the latest developments in the field of diabetes. That is why we are having this program named as Clinical Update on Diabetes, which helps doctors to treat patients in a much better way.
In the proper management of diabetes. Dr. Alok. This conference was officially inaugurated by the Honorable Minister for Industry, School and Mass Education, Mr. Devi Prasad Mishra, along with other dignitaries. The invited guests acclaimed the conference from the core of their hearts.
Dr. Talal, to many people I know, and Professor Tripathi, we'll be talking more about how clinically, if you want to address it, how to solve the patients as told by Dr. Alok Kanungo, how in a natural way, because he used to write and perhaps now he is not writing that much.
The problem of the depression is there with us, but sometimes we are not able to diagnose it properly, and sometimes we are not able to manage this symptom properly. Sometimes we just blame the patient that you are not doing the exercise properly, you are not checking it, but we do not enter to the person's mind why he is not able to do it.
Whatever incidence we are getting now, it has gone up to almost 20-25% more in this year.
Metformin is actually the drug which is actually 100% actually molecular drug. There is no complication to the metformin, or molecular patients are not developed any side effects to metformin.
Many times the first stage is controlled, but the postprandial expression remains.
In down south, in the famous CMC Vellore. But CMC Vellore is a very rational institute.
Is do's and do nots so that mistakes are not multiplied. Keeping that in view, with the guidance of all our seniors
Who have contributed massively to the field of diabetes in India to receive their Lifetime Achievement Award.
I've been overwhelmed and feel humbled for this audience that your academic service for this country.
We started the specialty in the country. I remember in the first RSD meeting in Madras.
But besides the work, the recognition of work also is.
And when he had taken the pain of attending that flying here, attending this flying there, it's very difficult to keep a balance between so many scientific challenges.
And then finally we will justify whether this drug should still
attest to JJ Group of Hospital and Professor of Sexology.
This 2-day scientific program kicked off in the early morning of 3rd December. The sessions were designed to touch and highlight the critical aspects of clinical diabetes. Our eminent speakers, masters in their respective fields, deliberated on its relevant angles.
This has been an extraordinary meeting, and in the meeting my lecture was on the the first line drug metformin, and I spoke about its pleiotropic effect, highlighted its recent indications in up to what extent it can be given in the diabetic kidney involvement, its effect on the heart failure, most important its anti-cancer effect, and its anti-aging properties. It was one of the drugs with so protean manifestations that it has stood this test of time and become the #1 drug in diabetes today. I think I would suggest that is a brilliant initiation, because to know the enemy, to overcome the enemy, to mitigate the enemy, we know the knowledge. And the kits is providing that knowledge in 3 spheres. The knowledge in the sphere of the brain, knowledge in the sphere of your attitude, like how do you approach diabetes, psychosocial aspects, and most important, the skills of the hand and the pen, the clinical training. And it has been Dr. Kanungo's entire focus on a clinical practical training in contradistinction to the theoretical training. So KITS has done wonderful for imparting this clinical, practical, hands-on, very close to day-to-day management training, which is of paramount importance. So I would rate it as a very important initiative, and it has been done year after year, 3rd year. And now it is going to be pan-Indian project. Dr. Kanungo also has a project of training all the doctors of the state on diabetes. And I wish him Godspeed and very good luck.
Management of these 2 dreaded complications is an extremely vital issue.
I am P.V. Rao. I am from Hyderabad. I was a professor of endocrinology at Nizam Institute. This is the third meeting I am attending of NUCD. I've seen Dr. Alok Kanungo being very active in diabetes programs for last 25 years. I'm also involved with RSSDA for last 30 years. And with Professor Tripathi and Dr. Shamal, I worked in Cuttack for several diabetes research programs. I have known Dr. Alok Kanungo very well, and I am very happy that he is being conducting this NUCD for last 3 years. Today I presented on hypertension and diabetes, the interactions between hypertension and diabetes. I am very happy that he has given me this topic for presentation today, and I am looking forward to such meetings in future also.
Proper management.
I'm Dr. V. Mohan, Diabetologist from Chennai. I'm here for the National Update on Clinical Diabetes arranged by Dr. Alok Kanungo. At the outset, I would like to congratulate Dr. Kanungo for the excellent way in which he has organized this meeting. We are all very proud of him. It's very important to have such updates because diabetes has today become a national problem. Today we have almost 70 million people with diabetes in India and more than 80 million people with pre-diabetes. It's also started affecting the poor people, the young people, and this has become a huge socio-economic problem as far as India is concerned. A lot of new developments are taking place in diabetes, and it's actually possible to prevent diabetes. And that is what I spoke about today in my talk. I said that by increasing physical activity and cutting down on carbohydrate, whether it's rice or wheat, unrefined, the refined wheat and polished rice, we will be able to cut down diabetes by nearly 50%. Everybody should walk for at least 30 minutes to 45 minutes, and those who are overweight, if they can reduce their weight even by 5 to 10 kilograms, diabetes can be prevented by almost 50 to 60%. I wish the people of Orissa all the very best. Orissa is a state where the diabetes prevalence is increasing rapidly. The changes that Bhubaneshwar I have seen a few years ago to now shows how rapidly you are growing. That's very good news, but at the same time, with that, diabetes will also increase because obesity will increase and diabetes will increase. So I think it's at the right time that such updates are being held, and I wish Dr. Alok Kanungo and Dr. A.K. Das, Dr. Jayant Panda and all the organizers all the very best. Thank you.
Regarding NUCD initiation, what is your opinion?
Regarding?
NUCD initiation.
Yeah. So regarding this update itself, this is the third time that this NUCD, the National Update on Clinical Diabetes, is being held. It's a very well thought out program. All the topics, right from prevention to its treatment, oral drugs, insulin, all the latest advances are being covered here. Here Dr. Kanungo has managed to get internationally known experts both from India as well as from abroad. Dr. Sanjeevi from Sweden, Professor Sheshaya, many famous people have come. So I think it's a great boon for not only Bhubaneshwar but also Orissa and this part of the country to have such a wonderful NUCD conference, National Update on Clinical Diabetes here. I wish them all success, and I hope many more such updates are held in the future.
There was another important session entitled State of the Art Lecture, and the speaker was Dr. C.B. Sanjeevi from Sweden.
So I am Dr. Sanjeevi. I am a professor in diabetes at the Karolinska Institute in Stockholm. Karolinska Institute is the institute that selects and awards the Nobel Prize for Medicine. I have been very fortunate to come and attend this meeting called National Update on Clinical Diabetes. It is the third meeting, and I have been coming for all the meetings so far, the first one and second one. This is a very good meeting, the biggest meeting in Eastern India in order to bring awareness for diabetes. both to the people as well as to the doctors, young doctors, to get themselves updated on new things. So this meeting is a must attend meeting with faculty from all over India as well as from abroad. So this is very good meeting for knowing more about diabetes. So coming to my talk on diabetes, I am working more on diabetes in children, and this particular area is given little attention. So my talk is also going to focus on how to prevent diabetes in children, and this focus is going to be more on how we can generate a vaccine for diabetes in children, and if this vaccine is successful, then it could play a major role in prevention of diabetes in children. Diabetes in children is slightly different in terms of etiology compared to diabetes in adults. It is possible to prevent it because of the involvement of immunology of the immune system of the body in making the disease, that makes it allows us to help prevent the disease. So there are several aspects to this prevention program. One is to give a vaccine, another is to replace the insulin producing beta cells. There are a lot of replacement strategies that are becoming available, which are getting more and more better. So I will focus on some of those attentions as well.
Young diabetologists of our country were invited to ventilate their views on modern techniques of managing diabetes, and the session was entitled
I am Dr. Vinayak Sinha. I'm an endocrinologist from Kolkata. It's lovely to be here at NCUD, which has been organized by kids, which is a wonderful effort on the part of Dr. Alok Kanungo and his team to spread information as well as education in the field of diabetes. I have been here to speak about SGLT2 inhibitors, which is a novel molecule in the field of diabetes, which is being shown to improve glycemic control in reduction of blood sugar as well as reduction of body weight. It also leads to quite a bit of advantage in the cardiovascular aspect of things, which is a big disease affecting diabetes these days. And it is wonderful to have come here for this conference with such a good attendance and lots of people eager to learn about diabetes. This in itself, I think, makes the conference a huge success.
Today we had a conference named National Update in Clinical Diabetes in Bhubaneshwar, organized by kids and Dr. Alok Kanungo. It was attended by many people all across Orissa and also from outside state and inside India. And the major discussion was on how we should improve the clinical utility of our knowledge in practicing diabetes, and my topic was on newer drugs in diabetes, where I discussed about what are the new drugs which are coming for the management of diabetes and how we can use an SGLT2 inhibitor in the management of diabetes.
Insulin being one of the important hormones in balancing glucose.
I'm Dr. Gangopadhyay. I'm an endocrinologist from Fortis Hospital, Peerless Hospital, Kolkata. And I would like to say that this is a very good initiative taken up by kids. I think it's Kanungo Institute of Diabetes Specialties Hospital, because this has brought up a lot of key opinion leaders in diabetes from across this nation in one roof. And in 2 days, you have got a compact program of various aspects of diabetes management, which for the physician, for the general physician, the MD physician, and also for the endocrinologist, this is a minehole of information that a person can get in a very short span of time from all over the country. I'm going to talk on a liraglutide clinical cardiovascular outcome trial, and I'm going to say how this new molecule is going to help the diabetes practitioners in managing their patients with diabetes. So this is what I'm going to talk about, and I hope and I wish all the success for kids in the future.
Myself, Professor Shotinath Mukhopadhyay. I'm from Calcutta. I congratulate Dr. Alok Kanungo for organizing this very wonderful national update on clinical diabetes year on year. this has been a conglomeration of diabetologists from all over the world. What was more interesting was the level of interaction that I witnessed from the local audience. Not only they turned out in large numbers, they very actively participated after each and every talk. I was given the task of talking on the art of insulin therapy, the practical nitty-gritties of how actually to inject insulin, how to store insulin so that it does not lose its ability. I also touched upon very briefly on the use of insulin pumps and the future areas of interest in terms of sensor augmented insulin delivery and very smart insulin pumps that use computer generated algorithms to regulate blood glucose levels in response to fluctuations in plasma glucose levels from time to time.
Diabetes being the greatest health hazard in our country, there is a demand for more and more research works to control it. Therefore, due importance was accorded to oral antibiotic drugs.
I'm Dr. Anand Moses from Chennai. I'm the former director of Institute of Diabetology, Madras Medical College. I'm very happy to be invited to this kids conference in Bhubaneshwar. This is the second time I'm coming to this conference. It's a wonderful place and a wonderful scientific session. The topic that I discussed today is on sulfonylureas. The sulfonylureas are one of the oldest group of drugs, almost 50-year-old drug. And with the advent of the newer drugs, there have been some confusion in the mind of the practitioners whether this old drug should be continued to be used or this drug has to give way to the new drugs. I have shown in my presentation that this drug is still a useful drug, particularly it's a low-cost drug in our situation, and it should be continued to be used. And there are the sulfonylurea groups of drugs are many. The newer sulfonylureas are safe, and the lower dose of sulfonylureas are quite safe, and they should be continued to be used, particularly in our country, for a long time to come.
There was an important session on the 4th of December entitled Comorbidities. Vivid discussions were conducted on the importance of early screening in GDM and minimizing hyperglycemia in insulin therapy.
I am Professor Chandalia from Mumbai. I am here at this NUCD discussing a very important topic, and that is how we should use insulin therapy very effectively without producing too much hypoglycemia. As we know that use of insulin is always attended by a very high incidence of hypoglycemia. So that to use in a manner which will prevent hypoglycemia is very important. And some of the tips that I have given in my talk is that use very small doses of insulin, multiple doses of insulin, use insulins of better quality which give consistent effect day to day, use insulin in type 2 diabetic always with the oral agent in order to sensitize the person to the use of insulin, and in some patients where there is a lot of hypoglycemia, we should revise the glycemic targets upwards. That means we should not control them very, very strictly. So I am pointing out some of these very, very important strategies to prevent hypoglycemia.
Regarding the initiation taken by...
I am very happy to be here in this meeting, the National Update in Clinical Diabetes initiated by the Kids Diabetes Center. This is spreading awareness of this disease in the medical community, and it is preparing the medical community to address the issues of our patients in large numbers. I think this is an excellent initiative introduced by Dr. Alok Kanungo in the city of Bhubaneshwar.
I am thankful to Dr. Kanungo to invite me for this symposium. So it's continuously he has been organizing for last 3 years. It's really very good. Good speakers have come around the country, and even international speakers are there. And I have been allotted to talk on diabetes and dysautonomia. Like diabetes, they have other kinds of complications like nephropathy, retinopathy, coronary vascular disease, coronary artery disease, and peripheral neuropathy. Similarly, diabetic patients also can have autonomic neuropathy, that is called as dysautonomia, that is the imbalance of the autonomic nervous system, that is called diabetic dysautonomia. So in that case, what happens, all the autonomic nervous system of the body that breaks down, and several systems of the body they are affected. So first of all, the important autonomic nervous system, that is the autonomic nerves that supplies the heart, that is affected. So that is called as cardiac autonomic neuropathy. For that matter, the patient normally they can have sudden death or collapse, postural hypotension, and some imbalance in the pulse rate, or sometimes the patient can have sudden cardiac arrest and sudden death. So we normally do not know how the sudden death occurs, but majority, maybe 60 to 80% of the sudden death could be due to cardiac autonomic neuropathy. Similarly, the gastrointestinal system that is also affected by the autonomic neuropathy. In that case, patient can have diarrhea, can have constipation, increased frequency in the defecation, and sometimes incontinence of the motion. In that case, also sometimes patient has bloating and fullness of the stomach, and patient has to take certain medications, and maybe sometimes prokinetic agents and antibiotics, and some bulking agents or laxatives can be used for that matter. And similarly also, patient can have defects in the erectile dysfunction, that is in the sexual dysfunction can happen because of the autonomic neuropathy, and bladder dysfunction also can occur. In that case, sometimes patient can have urinary incontinence, hesitancy, and full bladder, cystopathy, recurrent UTI, and impotence also can happen because of the sexual disorder. And one important thing that can happen, there is a disease of the pseudomotor system. That means the patient can have increase in the sweating or decrease in the sweating. So these are all called as autonomic nervous system dysfunction, or otherwise called as dysautonomia. So we cannot neglect all these things. So while testing for other complications in diabetic patient, we should also test for dysautonomias, especially when diabetes is more than 5 years in case of type 1 diabetes patient, and type 2 diabetes patient when they present to the doctors for the first time. So these are all the recommendations.
A memorial lecture of honor was dedicated to a person who had been treating the complications of diabetes, diagnosed during pregnancy with complete dedication.
I will hold it. You have to look at the lens on
I am Dr. Sashaya from Chennai, Tamil Nadu. I have come here to participate in the NUCD conference on diabetes and its problem. Now, my talk was on gestational diabetes mellitus, meaning the development of glucose tolerance during pregnancy. It is quite frequently occurring in our country now. It's almost about 14% of the population are having gestational glucose intolerance, or otherwise called gestational diabetes mellitus. Now they call hyperglycemia pregnancy. So this must be occurring everywhere. And then I wish, as a few days ago on the inauguration, Minister was here of suggesting that we must start a program in Odisha also to find out the prevalence of GDM in this part of the country. Now the next problem will be, now we recommend that all women attending the antenatal clinic should be screened for the hyperglycemia pregnancy. Now for that, the test has to be simple and easy to follow. The test that is being done is too cumbersome. We have developed a system by number of studies, that blood sugar after the glucose, 2-hour glucose, more than 140 milligram, she could be diagnosed to have a gestational diabetes mellitus, GDM. So this is a large number. We collected about 12,000 people and came to the conclusion. Then we suggested any woman coming to the clinic, any doctor's office or obstetrician office, should be given without necessarily that she should not be fasting. As she walks in, they call walk-in test or point of care test. She used to be given 75 grams of glucose and do the blood sugar after 2 hours. To more than 140 milligrams, we call them as women having the gestational diabetes mellitus. Doesn't mean that may be a problem, may not be a problem, but depending on how we do it. So these women who diagnosed 140 milligrams are given advice about nutrition, how to adjust their meal plan and maintain the blood sugar 120, then there is no further problem. So we can follow up and see every month blood test is done. I recommend only 2 hours because fasting will never go up in our Indian women. Rarely it goes up more than 90-95. So if it is going to be 120, which are meal plan and advice, then you must think about the therapeutic. Here you must refer to a doctor who is well informed about the treatment of diabetes. He will start them on insulin. Dose I am not going to discuss here, that is different, but doctors should do that. Normally we don't recommend oral drugs for the pregnancy. But if a woman is already taking metformin, in those people with PCOD, what we call PCOD, polycystic ovarian disease, they would usually give metformin to conceive. If a woman conceives on metformin, then she may be allowed to continue metformin. Otherwise, if starting first treatment, it is better to give only insulin. In case the woman doesn't want to take insulin, then probably with due advice that or warning. We won't say warning, we can explain the problem of other, we are not still convinced of safety, we can start a small dose of metformin. So far in my experience, I have not come across any problem with metformin. So I feel it can be given also. But for the people not to criticize you, please give them insulin. So with this, if you maintain the blood sugar level, fasting 90 and 2 hours 120, the chance are there. The children born to them with this blood sugar level won't develop diabetes in the future. That is our concept. And not only that, the woman also may not develop diabetes in the future. So by one test and treatment, we can avoid both mother and child become diabetes in the future. That is how we can prevent the epidemic of diabetes. Thank you.
Obesity is one of the prime factors causing health disorders nowadays. People are normally eating more and more and lacking in physical activity.
I am Chairman, Fortis CDOC Center for Diabetes, Obesity and Endocrinology at New Delhi. My talk, the topic of my talk was Sarcopenic Obesity, which is concerning muscle function, muscle mass, muscle weakness in Indians and its relation to diabetes as well as increased amount of fat in the body, especially in the abdomen in Indian population. Both are important for diabetes. This particular conference is very well organized and I am very deeply thankful to Alok Kanungo and Jayant Panda, everybody in the organizing committee for wonderful conference, and this will help physicians in this part of the country, all over Orissa, to be educated in day-to-day management of diabetes. They will be able to manage their diabetes much better than before, taking some of the points from this conference from eminent speakers who have spoken here.
Diabetes is a disease of blood vessels. Prolonged diabetes normally causes neurological problems and is known as diabetic neuropathy. Dr. Ajay Kumar. Heart attack is caused basically due to hypertension and diabetes. But cardiovascular complications in a diabetic patient should never be neglected as it's a painless killer.
My name is Dr. Ajay Kumar. I am a consultant physician and diabetologist from Patna. Yeah, I spoke on painful diabetic neuropathy management today, and I think the most essential component of this is to provide good reassurance to the patient. Because many of the patients are led to believe that painful diabetic neuropathy is a very difficult condition to treat and they have reached the end of the road. That's not true. If you provide good reassurance to the patient, good glycemic control, overall metabolic control, and then judicious combination of various treatment modalities, then majority of the patients are benefited. What is important to understand that depending upon the patient's phenotype, say for example, if you are dealing with a patient of painful neuropathy who is also depressed, then in that circumstance, a tricyclic antidepressant is much better. On the other hand, if someone is depressed and is not having any sleep problem, then maybe drugs like SSRIs, like duloxetine, could be of great importance. There is also an important role of topical preparations in the management of painful diabetic neuropathy.
Regarding the initiation taken by kids for management of diabetes.
Yeah, I really appreciate the initiation taken by kids for the various aspects of diabetes management, and I'm sure this is going to be of great benefit to the patients as well as to the general fraternity. Thank you very much.
Another prestigious oration, Professor B.B. Tripathi Gold Medal Oration, was delivered by Dr. Samar Banerjee.
I am Dr. Ravi Kant Mishra or R.K. Mishra. I am President of Jharkhand Cardiological Society of India as well as Jharkhand Diabetic Forum, practicing in Jamshedpur. You see, diabetes, and so far as the NUCD is concerned, NUCD is doing a great thing for not only for Bhubaneshwar, for the Odisha as well as the East Zone as well. We have a large number of people come here, and basically we discussed the clinical science. Because we are we have very less resources, so we want to do good things in diabetes, and diabetes being the capital of the world, and the moment you diagnose diabetes, it is ISD equivalent, that is ischemic heart disease equivalent. Diabetes and heart disease goes hand in hand, so it is very important to design at a very cheap price how to prevent diabetes.
Was the most respected physician of our state, deserving national reputation for working on diabetes.
I am very glad to attend this conference of NUCD headed by Dr. Alok Kanungo. Last time I also came here, this time I have come for an oration. I feel proud because the oration is after one of my guru, Professor B.B. Tripathi. It is an emotional situation. But I am very pleased and satisfied as a senior person. I was the president of RSSD, I was the president of DIPC, I am the president of Association of Clinical Diabetology, I am editing journal. That Alok Kanungo and his team from KIDS has taken a great initiative to train the doctors and also paramedics equally. Just Dr. Chandalia told in his lecture that the initial 5 or 10 years of the life of a diabetic is being treated by family physician, and rarely they come to the experts. And these initiatives to train the doctors are very much essential because the basic doctors must know at least the working knowledge of the diabetes, as diabetes is growing like anything and they are not so much experts in diabetes to treat the diabetes from very beginning and to control them. This is a unique opportunity to train the doctors for the basic parameters of the diabetes, how to diagnose, how to monitor, how to control, how to assess the complication. The stalwarts from all over the world has come here, particularly big persons like Professor Sesaya, Professor Chandalia, they have all come. I think this will help and add to the knowledge of the practicing physician in Odisha and also the surrounding places. I feel this should be continued and more people should take interest in joining this program so that the knowledge of the diabetologist and family physicians improve, and ultimately at the end the diabetic patient get the best treatment, because this is one of the disease where if you treat properly from the very beginning, the patient may behave as a person without diabetes. I hope all the success of the conference. I express my all thanks and gratitude to Alok Kanungo for taking this initiative. Thank you.
The first endocrinologist of our nation, the living legend Professor R.J. Das, spoke on Common errors in managing type 2 diabetes, entitled State of the Art Lecture.
Well, I talked about the comprehensive management of diabetes and the errors that people generally do in managing diabetes in this country. Now, generally, when you diagnose somebody to have a diabetes, we see that fasting is more than 126, and after a glucose load of 75 grams, oral glucose load 75 grams, the blood sugar is more than 200. If there is a family history of diabetes, the first thing that we should do is to ask whether the children are obese, if the children are physically active, and if they have the children are not, then emphasize that the parents must see that the children become slim and do not use the junk food, and at least daily walk for about 40 minutes and do not sit at one point for more than half an hour. And if they do that, at least we prevent diabetes in that family. Then coming to the individual who has diabetes, we have to see not only his blood sugar values, but we have to see whether his lipids are normal, his cholesterol is normal, the LDL cholesterol is normal, the triglyceride is normal, and whether the blood pressure is normal. Now, the blood pressure normal means that we generally do not check 140/90 and above is high blood pressure. But in fact, some people have blood pressure of 90/60 when they're adult. And if their blood pressure is about 120, 180, they are already increased from the 90/60 to about 20/30 more. So therefore, they need treatment. Now, treatment means that you need to control their diet if they're weight controlled, and do not take extra coffee, tea, do not take extra salt, and not take salty diet or salty food. If you do that much and then you see their blood pressure after about a month or 2 months, if it has not come down to their previous level that they had about 90/60 before, then you start them giving the drug, small amount of the drug, and see that blood sugar becomes normal. If the lipids are abnormal, you give them the drugs to cut down their lipids and they become normal, and at the same time you tell them that you walk, you don't sit down all the time, avoid all the junk food, never take any fatty food and all that. I'll pass two things about the Bhubaneshwar. Bhubaneshwar has 14,000 Bora Gupchup shops at the roadside. And that is one reason why the diabetes is increasing in Bhubaneshwar. In fact, it has gone beyond 10%. Again, the country average of 7%. So unless people are educated about this, not to take the junk food, not to take this food. Even school children, near the school there is a junk food available left, right. They don't take breakfast in the morning at home, and they come and take this junk food near the school. So that is all adding to this. So you need a movement for good health. If you do that, then of course the things will be much better.
Research Society of Studying Diabetes in India, RSSDI, has formulated some basic...
This initiative by kids to have a national update on diabetes and involving all the national faculty in diabetes is a very good venture, and it will go a long way in spreading awareness about diabetes and increasing the capacity of doctors in Bhubaneshwar and Orissa state, and will help ultimately in the improvement of diabetes care in the state. I will be talking today on an important subject about glycemic monitoring in type 2 diabetes. And I'll be specifically talking, because I was the president of RSSDI, we'll be talking about the RSSDI guidelines as to how we should go about monitoring blood glucose in diabetes, especially regarding the use of HbA1c, regarding use of fasting blood glucose and self-monitoring of blood glucose, and what are the guidelines given the circumstances of our country. I'll be primarily dealing with that, and as we all know, SMBG is particularly useful in patients who are taking insulin, especially those who are on intensive insulin regimens, pregnant women, type 1 diabetics, and certain specific situations in type 2 diabetics where we need to closely monitor the blood glucose, and a self-monitoring by a glucometer by the patient will go a long way. Apart from this, of course, the HbA1c is the standard method of monitoring glucose and has been shown to be related to the long-term complications, and as RSSDI advises, we need to maintain our HbA1c below 7 to prevent the long-term complications of diabetes.
It's rightly pointed out that proper care must be taken of the
Today my talk is how to prevent diabetes complications of food. So here our job is to appraise the doctors as to how to take care of their patients. Everybody on the earth wants to walk with his own feet, but to the bad luck or hard luck, diabetes patients cannot vouch that they will walk throughout the life with their own feet. So who will take care of them? Only the doctors can take care of them. Not only that, they have to take the awareness of the patient so that how the patient himself will take care of his feet, when to come to doctor, and how to safeguard his feet by wearing footwear. So here the main job is to educate the doctors and the other people who are responsible for the diabetic foot. So what we do here is tell people, the doctors, how to take care of their foot throughout the life. Just let me give you one example. In case of diabetes, there is a neuropathy occurs. Neuropathy means the foot loses its sensation. Patient doesn't know when he is even walking on a very hot ground, and as he comes down to his home, there he finds a lot of blisters. Similarly, the bike silencer complication is quite common. While they are moving with their bike, they get injured, that is thermal injury. Similarly, suppose a patient will see to his feet and know that there is something wrong in his feet, swelling there is in his feet, redness in the feet, immediately he will go to the doctor and doctor will treat him and he will be able to save his feet. Or else there will be amputation of either toes or foot, or sometimes they will land in below knee amputation. So now the incidence of diabetes is growing as well as the foot complications are growing, and the greatest calamity is below knee amputation. So now the conference only highlight how to take care of the foot and send the patient early to the foot care clinic so that the limb can be saved. Thank you.
More than 600 delegates attended the conference on the 3rd and 4th of December and interacted with the national and international level faculties. This initiative can go a long way in helping the doctors of Odisha in treating diabetes as best as possible.
I am Professor Jayant Panda from ICU Medical College, Cuttack. We had 2-day session, the National Update in Clinical Diabetes at Bhubaneshwar on behalf of the Kids Hospital and Cuttack Diabetes Research Organization, where more than 500 doctors from different parts of the state attended and more than 100 faculties from different parts of the country as well as outside country attended. We had a team from Karolinska Institute, Sweden, who not only attended the program, they learned, interacted, and we had faculties teaching our delegates in the program. From the diagnosis to treatment, monitoring, and different parts of diabetes management were discussed thoroughly. The monitoring part, the drug part, the complication part, the gestational diabetes, why diabetes is attacking people in the rural belt, why diabetes is attacking people in the young age was discussed thoroughly, and many attendants, the people who attended this program, the attendees, got the benefit of this discussion and carried the take-home message to practice in their daily day-to-day clinical practice. So, to summarize, this 2-day long program touched from epidemiology to prevention of diabetes, and around 100 faculties taught more than 500 doctors in different subjects related to their difficulties, and this particular knowledge a change in the approach is going to benefit thousands of patients who take the treatment from these doctors at different parts of the state of the Odisha.
The medical students of Karolinska University, Stockholm of Sweden, attended this eventful conference and returned with a vibrant hope that their invaluable experience here will definitely help them in providing effective treatment to the diabetic patients in their own country.
My name is Oscar, and I'm a medical student from Sweden, Stockholm, from the Karolinska Institute, which has a collaboration with the kids hospital here in Bhubaneshwar. So diabetes is such a big disease, and it has growing numbers, and I'm going to take back a lot of knowledge and a lot of inspiration back to Sweden from this conference.
This is kind of a different perspective, a more global perspective for us. And in Sweden we have a lot of people from different countries, so it's really good to take in this knowledge as well from other parts of the world. We feel very welcome, and it's really good to see all the different doctors and how they choose to present and share what they know.
There is a cardinal necessity of such conferences and CMEs at regular interval, as the busy and monotonous schedule of doctors never provides them with a suitable pause to go through world-class treatment techniques. Such conference for them is indeed a ventilating opportunity to experience updated techniques of treatment under one single roof.
Now, as you see, lot of these diabetic conferences has been organized in different part of the country as well as in our Odisha. Every meeting, even it's a medical conference, there is a lot of diabetic topics. Now, so you can importance how much diabetes treatment and diagnosis has gained importance now for a doctor as well as for the public. You find gradually the incidence of diabetes is increasing in Odisha as well as in India, and different diagnostic facilities have increased. Early diagnosis is possible, and various drugs have come out, including insulin, oral hypoglycemic agents, and how best they can be given, which patients can talk, which type of drug. In these meetings, it is more conveyed to the doctors who are working in the periphery as well as working in different city hospitals, so that they can use proper drug for different type of persons. Today you are hearing one thing, that is gestational diabetes. In pregnant ladies, early detection of diabetes. So complications of diabetes in the children can be prevented. In their child which is growing in the uterus can be prevented by early intervention. That's what you are hearing today is a very important topic. Possibly that will be implemented very soon in Odisha. So all pregnant ladies attending antenatal clinic, the diagnosis will be done.
Good afternoon, friends. I am Dr. Anil Kumar Virmani from Jamshedpur, consultant physician. I had come here in the National Update in Clinical Diabetes organized by the kids, and Dr. Alok Kanungo, who is doing a wonderful job in educating patients for diabetes awareness, creating a CME and educating his doctors throughout Orissa. I think it's a wonderful job he's doing. Today, my talk was basically on lifestyle modification and exercise, basically physical activity. And this is, I think, one of the most important and neglected issues in the management of type 2 diabetes, coronary artery disease, or you think of any non-communicable disease, including cancers. If you exercise, and when I say exercise, it means minimum of 30 minutes of walking daily, or having not sitting for more than 30 minutes at a time, and walking for 2 to 3 minutes. I think that is what is very important in the total prevention and treatment of all non-communicable diseases, including diabetes, coronary artery disease, and cancers.
Good afternoon. I am Dr. Sunil Gupta. I am a diabetologist at Nagpur. And I congratulate Dr. Alok Kanungo for organizing this meeting, and congratulate to the team of kids for this meeting. My talk is on in lipohypertrophy and the FIT guidelines. And everyone knows that almost you are 20 to 25% of your diabetic patient, type 2 diabetic people are on insulin therapy, and 100% of type 1 diabetic children as well as other people are on insulin therapy. So insulin therapy is being there for quite a good number of our people coming to us in the clinic. And there, because this insulin therapy is there for sometime for multiple years, and for type 1 diabetes for the whole life, we have to understand there is some problem with insulin therapy, that if the insulin injection is given repeatedly at the same site, if you don't rotate the needle, if you don't change the needle properly, if you don't take proper precautions, it may create more issues. There will be situations when you will find that you have taken enough dose of insulin, but still it's not acting properly. So the efficacy of insulin get disturbed or get reduced because of the repeated insulin at the same site, because of the local adipose tissue swelling, that's called as lipohypertrophy. So my talk today is on lipohypertrophy, which is in which patient, what are the risk factors for lipohypertrophy, which are the patient we are supposed to look for it, what are the preventive measures we are supposed to do for preventing lipohypertrophy, and how should we clinically detect it, so that we can teach our people with diabetes, those who are on insulin, to prevent the development of this. And lipohypertrophy is one of the very, very strong, important factor here, because 70% of type 1 diabetes as well as 30% of type 2 diabetic might have lipohypertrophy, and it is one of the preventable complication of diabetes, to have a best control of and best efficacy of insulin therapy in given situation. And that is why every one of us should be getting involved in diabetes education. We should be educating our educators, and educators and nurses can help you in preventing lipohypertrophy in patients who are on insulin therapy. So this is again going to be one of the rare talk. It is not being seen across in many of the meetings, but we have our own original data on lipohypertrophy, which we have presented in International Diabetes Federation World Congress in Vancouver, Canada. And the same data I am going to share, and we have some more data to again share with you. With this, I stop here. Congratulations once again, KIDS and Dr. Alok Kanungo and his team.
Any conferences and trainings, they help much than reading books and going through internet programs. So when somebody attends a seminar, there are a lot of discussions, there are question answers. From that they clear their doubts, and also they become updated.
There was obviously a grand arrangement of musical nights for the entertainment of faculties and delegates after a hectic and trying schedule of academic discussions.
संतों के संग रंगी मोहन के रंग मीरा प्रेमी प्रीतम को मनाने लगी। वो तो गली गली हरी गुन गाने लगी। ऐसी लगी लगन मीरा हो गई मगन, ऐसी लगी लगन मीरा हो गई मगन। वो तो गली गली हरी गुन गाने लगी। ऐसी लगी लगन